When life becomes painful for you or someone you care about, how should you choose to respond? This week we're off balance, on purpose, and in pain. Life is pain, Highness. Anyone who tells you differently is selling something. That line is from The Princess Bride by William Goldman, one of the most quotable movies ever made. And it resonates because we know there's some degree of truth to the statement. Pain is universal. We all experience it at different times, to different degrees, and in different ways. Physical, emotional, psychological. But the existence of pain is known to all of us from our earliest memories. We try to avoid it or minimize it, but we can't make it go away completely. Today I want to give you two strategies, the first for dealing with your pain and the second for relating to others about their pain. Now this is super generic and non-medical advice, but just some thoughts that have worked well for me. When we experience pain, it's easy to think, this isn't normal. But again, some degree of pain is actually pretty normal. Pain is information, the body's way of telling you to pay attention. Process it as information first, almost as an objective observer, and then seek more information about the type of pain that you're experiencing to understand what it's trying to tell you. If it's a physical injury, address it very quickly. Muscle tension can cause great pain, which can sometimes be released through movement or massage or stretching. Because your nervous system is incredibly complex and interconnected, the pain that you feel may actually have a cause or a component that is unrelated to the area where you experience it. Anxiety, stress, fatigue, dehydration can cause or amplify physical pain, so be curious about the cause rather than jumping to fearful conclusions. When someone else is in pain, help them through it. Encourage that they address the pain, but don't add additional stress. Here's the tricky part. Pain and pain tolerance are totally relative. There is no way for you to experience their pain or vice versa. We can ask and empathize, but trying to help can backfire because pain is just so personal. You can't fully understand what they are experiencing, so be supportive and suggestive, but resist the urge to prescribe a solution. Life is pain. Not always, but often. And when we accept this, we begin to see pain as a familiar, although not always welcome companion. You'll come to understand what's normal, what's tolerable, and what requires additional concern. When in doubt, figure it out, pay attention to the signals, and encourage others to do the same. And until next week, stay off balance on purpose.